and welcome to Nutrition Therapy by Lucy. This is a channel where we talk about food, good nutrition, and health. Thank you for your support, for always watching my videos, leaving a comment, giving them a like, even for consuming my content. I am so grateful. But if you're here for the first time, please make sure you hit on that subscribe button, the red button. So today we are talking matters pregnancy. We'll be handling a topic on pregnancy, and that is preeclampsia. With me, I have a specialist. He'll be taking us through preeclampsia. We get to understand the condition, and also we go to the prevention and treatment. Dr. Simon,
yes.
Karibu sana.
Thank you very much.
And thank you for agreeing to do this.
You're welcome.
Kindly introduce yourself to the audience.
So my name is Dr. Simon Kigondu. I'm a consultant obstetrician and gynecologist. Obstetrician is the gynecologist who sees the ladies when they are expectant. Gynecologist is the gynecologist who sees the ladies when they are not expectant. I think there is a lot of confusion usually on those two, but now I think that is clear. So, and I have a private practice at Excella Healthcare, which is at KMA Center, 5th floor, suite 503. Also, I'm the gynecologist at Kegumo Sub-County Hospital, and also double up as a council member at the Kenya Obstetrics and Gynaecology Society, and also the Secretary General of Kenya Medical Association.
Hey, Doctor, uko na title mingi.
Those are only 4.
I think we are happy and glad to have you, and we are having a gynecologist, not just any general practitioner, but a specialist, a gyna, and umesema ni
obstetrician.
Acha tu nifikisha kwa obs. So he'll be taking us through preeclampsia. Doctor, kindly take us through in the most simpler ways. What is preeclampsia?
So just to start from a background, the 5 major killers, so to speak, of pregnant mothers are bleeding, which is hemorrhage in technical terms, hypertension, of which preeclampsia is one of them, a ruptured uterus, infections, they're called infections, and a lot of energies go towards preventing deaths of mothers by managing these conditions. And hypertension in pregnancy is one of the major ones. Preeclampsia is a subset of what are called gestational hypertension. Hypertension in layman's terms is blood pressure iko juu. You know, when your blood pressure goes up. There are normal values for blood pressure. So we say that blood pressure below, blood pressure is measured in what is called an upper figure, called the systolic figure, and a lower figure, called a diastolic figure. If a blood pressure is considered normal below 130, 140 as the upper figure, systolic, and 90 as the lower figure. So every time you go to the doctor and they put a machine here, it will give 2 readings. The up one, 140, below, that's normal. The lower one, 90 and below. Now, when you start getting what is called hypertension, then these values are consistently above this. And when this occurs in pregnancy, then that is called gestational meaning pregnancy hypertension. When that is complicated further by damage to several organs in the body, which is now measured after what is called 20 weeks of gestation, 20 weeks of being pregnant, then it is termed preeclampsia. Traditionally, pre meant before. Eclampsia is a convulsion when you're pregnant, you see, with no other reason. So that was the traditional name, but as studies have gone on, the name has remained, and some of the features are being defined more and more. So that in a nutshell is an overview of preeclampsia. So preeclampsia can be, in summary, defined as hypertension, high blood pressure, at pregnancy detected from 20 weeks of gestation onwards, with features suggestive that it is causing damage to other parts of the body. Yeah. And maybe just to put that in context, if you get someone who already has hypertension, high blood pressure, and gets pregnant, the blood pressure problem in that pregnancy is called chronic hypertension. They had the hypertension before, so it is not as a result of the pregnancy. When you start catching it at 20 weeks, you see, someone was probably normal, and then 20 weeks onwards, you start measuring and you see the blood pressure is going up, then it is probably related to the pregnancy. And that preeclampsia now becomes a subset of that. So what we are saying is that that blood pressure, when it's high after 20 weeks of gestation, can have damage to the other organs, that's preeclampsia, and no damage to the other organs, which is just normal gestational hypertension.
Okay, wow, I think you expounded it very well.
Yes.
So when it comes to preeclampsia, there is damage of the other organs.
Yes.
And gestation is just high blood pressure.
So gestational hypertension is blood pressure that is seen when someone is pregnant. As opposed to what we call chronic hypertension, which someone had blood pressure before, then became pregnant.
Yeah.
This other one is someone became pregnant, then hypertension developed. And now preeclampsia is a subset of that. And the reason for that is that it is seen to be caused by factors related to the placenta.
Okay.
You see? So when you're not pregnant, there is no placenta. So when the placenta is not there, then the hypertension is not gestational. You see? So that is the difference.
Now, what about when it comes to eclampsia? There is pre, now there is eclampsia.
Yeah.
What differentiates the two?
So, eclampsia is a condition, is convulsions. And convulsions that occur in a context of preeclampsia are called eclampsia. You see? So let's go back. We said that preeclampsia, this placenta is not having, we said the placenta is not having good nutrition. You know, when you get pregnant and the placenta forms, the blood flow between the mother and the placenta ought to be having no resistance, so that the food and the oxygen is able to diffuse easier. But in preeclampsia, the blood vessels are not as widened as they are supposed to be. So there is some form of resistance. As a result of that, you get some chemicals that are released because of what is called oxidative stress, you see? And that they are released into the mother's circulation, and they go and affect the blood vessels in all other parts of the body. These chemicals stimulate what is called, they make the vessels vasoconstrict. Vasoconstrict meaning inafungana, and therefore that is blood pressure. Actually, one of the reasons of blood pressure is that you have a vessel in which blood is passing, and they constrict like this, and the pressure goes up. Yeah. As a result of this, if that happens in the brain, then you can get a bit of brain damage that leads to a dysfunction of the brain that leads to convulsions. And convulsions meaning that you are shaking, you're getting tonic-clonic. And that is as a result of low oxygen in the brain tissue, as a result of those vessels constricting, and therefore as a result of the pregnancy. And this is termed eclampsia. So eclampsia is just one of those end organ damages we said that results from that process that started in the placenta called preeclampsia. And maybe as we go to how you would detect that, is that the symptoms start manifesting as it can be that convulsions, which is showing an effect on the brain. An effect on the eyes is that people can see marudurudu, you know, you start seeing scotoma, blood vision, you see. Yeah. That is as a result of those blood vessels in the optic nerve, you know, getting less blood, less oxygen, and these are the symptoms. You can get a headache, yeah. because now the tissue is having low oxygen, and a headache is a manifestation.
Talking about severe headache, not just.
Yeah, so the headache can be severe. So now depends on, as the blood pressure, depending also, the higher it is, the more severe it is. And it can even now end up in a stroke, meaning that the pressure is so high that one of the vessels ruptures inside the brain, and that leads to a stroke because it causes damage to part of the brain that helps in movement. You see, we can go down now to the chest, whereby the preeclampsia also predisposes to clotting, you know, some of the clots, and so the blood vessels in the lungs can close up, and you start getting like water in the lungs, you see, so you start getting breathing difficulties in a condition called pulmonary, which means the lung edema, which means water in the lungs. Yeah. Then if you go down to the liver, sometimes you can get the casing around the liver rupturing, you know, you get bleeding just below the liver, you get, and so some people will come with pain at that area, and a lot of times you may confuse it with acidity. And if someone is pregnant and they come with symptoms of acidity, you must look at the blood pressure, because people miss unapewa 130, and the next thing we see is convulsion, you see. So you must look at it, because the liver gets a problem with that. And you go to the kidneys now, you know, the blood vessels in the kidneys start shrinking, and you start getting some damage to the kidney of the mother, yeah? And that can lead to maybe low urine output, you see? And so you start seeing the urine becoming dark, you know? And those are some of the symptoms. Now, because this mother is pregnant, the effect also occurs on the fetus, you see? So you start having the blood supply and oxygen is not as good as it should, you see? And therefore, the baby stops growing as well as it should, you see? So every time you come to the gynecologist, we usually check. I don't know whether you've seen where we press the baby. Yeah. That is usually to see, is the baby growing as expected? So if someone has this preeclampsia that is affecting the baby, then when you come, every time you come to check, we see that this uterus is not growing as it should. That is called intrauterine growth retardation, meaning that the baby is not growing as fast as it should as a result of that problem in the placenta, where the exchange of food and oxygen is not as well as it should, you see? So one of the symptoms is that it can go on like that, and now the placenta stops even doing that exchange, and people can have, the fetus can die inside, you know, with time, you see? Those are some of the things that we keep measuring to see, might this fetus die if we continue like that? You can also, a complication of that is also a separation of the placenta, you know? Preeclampsia may be associated with a separation of the placenta. These are all these things that when you start getting end organ damage, as we have put, is called severe preeclampsia, you know? At the beginning, when the so-called, previously was called mild preeclampsia, but now we have said it is preeclampsia. And when you start getting features of organ damage, it's called severe preeclampsia. Preeclampsia with severe features, you see? So we had said that the placenta can separate. That in medical terms is called abruptio placenta, meaning it has separated, and bleeding behind that can lead to death of the fetus. And that a major change also occurs in blood, whereby you can get one of the major fears we have, or a condition called severe preeclampsia, is when what are called platelets start going down, you know? Platelets are cells in the body that help in clotting, you see? So this process of preeclampsia may lead to a decrease in platelets over time, and when you can't clot, how do you present? Your skin starts getting, you know, discoloration, because like there is bleeding under the skin. When you brush teeth, you know, you can be getting bleeding gums, you know, and when and delivery for instance, you can get bleeding, because platelets are used, after delivery, you're supposed to clot well. So if the platelets are low, then that can be a problem, you see. Another condition associated with preeclampsia, when it now starts getting what are called severe features, is, as we have said, damage of the liver. So the liver you start getting that pain that is there. And one condition associated with preeclampsia and liver damage is called HELLP syndrome, HELLP, which means that you've taken the blood, the platelets are low, LP at the end. Hemolysis, meaning there is breakdown of blood, HE, and hemolysis, elevated liver enzymes. When damage occurs to the liver, it produces what are called transaminases in the blood, you see. So ukipima na damu, when you take the blood, then you see the enzymes that are produced in the liver are elevated. So this is preeclampsia. It's actually multi-organ. It's almost a disease of the whole body, sort of, but the initial stimulus is that placenta, that abnormal interaction at the placenta, whereby there is no good exchange, and what is called oxidative stress causes the release of chemicals into circulation. And these chemicals go and, they make blood vessels everywhere, sort of constrict, and you get clots. So that, I think we've covered a lot of many issues, but I think you can ask your next question.
And are there some of the risk factors, maybe before pregnancy, are there risk factors that maybe get into pregnancy and might get gestational hypertension, which might maybe go to preeclampsia, the risk factors of developing preeclampsia?
Yeah, so generally part of the reason people, the need for what is called antenatal care is because sometimes you may think one pregnancy has a higher risk than another, but a lot of times in pregnancy we have seen some they are not predicted. We didn't know, this particular person would get preeclampsia or not. But some of the associated features are similar to the risk factors of the normal hypertension, when people are maybe obese, or people already have hypertension and have a risk of hypertension from history, so to speak. And smoking, if people are smokers, then that risk is also higher. And other risk factors are, by the time you leave here, you'll be a doctor. Other risk factors are associated with where we have said the condition sort of stems from the placenta, So conditions where the placenta is bigger, is bigger, then would probably predispose to that. These include twins and multiple gestations, you see, and that would sort of predispose to that. A lot of times previously we saw extremes of gestation when someone has maybe the first pregnancy, sometimes it was associated with that, and extremes of pregnancy, very many pregnancies, probably the uterus has delivered many times, and the placenta has to sort of look for a good attachment area. It may be bigger. So those are some of the risk factors.
Okay, wow. And so does the condition maybe go away immediately after delivery? Ama itabaki tu?
So preeclampsia can occur during pregnancy, during labor and delivery, and after delivery, you see. So and that's why you have to be vigilant all the time. You have to keep vigilant. So and that's why blood pressure is measured at all stages. So, and therefore, to answer your question, after delivery, actually this is probably the most common. Blood pressure must be measured usually, especially within the first 72 hours, because it can occur after delivery. Now, after delivery, we continue managing it until when it clears. And what are the parameters of getting finished? the blood pressure. So initially, for instance, if you are discharged from hospital, you continue with blood pressure medicine and then we see you after 2 weeks. If after 2 weeks, for instance, your blood pressure has sort of settled, and then we can taper down there. But there are some people who now continue even and now get the hypertension itself. You see, this was started by the pregnancy, but now they probably had a higher risk factor, and therefore continue into what is now called chronic hypertension. You see, so that can continue, but the aim is to monitoring. So we've seen mothers who get preeclampsia, and we give them medicine. After 2 to 6 weeks, that goes away. We've seen mothers who now continue and now become chronic hypertensive, such that in their next pregnancy, they already are on some form of medication for preeclampsia.
And maybe, I know you've talked about some of the complications, but maybe you can take us through again some of the complications during and after delivery, especially during delivery.
Yeah, so complications of preeclampsia, and that's why it's very important to manage it before it reaches that stage of complications. It can be to the mother, it can be to the fetus. So to the mother, we started with the brain and said you can get convulsions, eclampsia, yeah, and the liver, you can get some form of liver damage, and the syndrome I talked to you about, called HELP syndrome, is it's really associated with that. Kidney damage, you can get acute kidney injury, some even requiring dialysis up to 6 sessions. Yeah, that's how tough that one is. And other signs and symptoms, some people can even get dehydration from nausea and vomiting, acute new onset nausea and vomiting. And we had said chest congestion, which can be pulmonary edema. Pulmonary is the lungs, edema is water in the lungs, so you get breathing difficulty. So it's one of the what is called the differentials of COVID. If you have a pregnant mother, they're having difficulties breathing, I say, hey, you have done COVID.
Yeah.
Also check the blood pressure, the clotting factors and things like that. Yeah.
What about when it comes to fetus? Are there maybe...
Yes, yes. We had said the mother. Now, in terms of the fetus, we had said the issue is with the placenta. So when you do not have good supply of nutrients to the baby, then the baby may not grow well. A condition called intrauterine growth retardation, meaning the baby is not, so the baby gets smaller than expected. So a baby is supposed to be 2.5 kilos, for instance. At 36 weeks, this baby of ours is 2. It can proceed and lead to death of the fetus. Yeah. It can also proceed and lead to separation of the placenta, which can lead to bleeding. It's one of the causes of hemorrhage. You remember we said the causes of maternal death include hemorrhage. And one of the major causes of hemorrhage in pregnancy is that abruptio placenta. As you can see, that this preeclampsia can lead to, so you have 2 problems here. You have a very high blood pressure and bleeding, and one comes before the other. So those are the complications that may occur.
I think tumeongea tu vitu za kushtua the complication. I don't know what is there a condition. Can you prevent it? Because when it comes to pregnancy, a pregnant mom can do just anything to prevent some of the complications. Can it be prevented?
That's a good question. So prevention can now be divided into 3. There's what is called primary prevention. As we have said, this preeclampsia per se comes when you're pregnant. Yeah. So if you are not pregnant, then you have prevented yourself from getting preeclampsia. That's actually called primary prevention. So family planning and things like that, so you don't get pregnant. But now when you're pregnant, then we can do a risk assessment for you. Say, this one, although we have, the caveat is that every woman can get preeclampsia if you're pregnant. Yeah. There is the ones who are already, people on chronic hypertension are at a higher risk also of getting, you can get preeclampsia within chronic hypertension. You see, we say the chronic hypertension can go all the way without end organ damage, you know, damage to the baby. But now they can also now get that, whereby you that. So the prevention of that is so it's what is called if you think that someone is at risk, then junior aspirin has been shown to have good effects. Junior aspirin is given, you know, from early on. Yeah. Two, there is calcium supplementation, and being a nutritionist, I'm sure you know some of the benefits of calcium. So calcium supplementation has also shown some benefit. And then we go on to what's called early detection. You see, if there are two scenarios: you don't come to clinic, and when the first time you present to a health facility, you're convulsing. You get, but every time you come, like we do antenatal clinics, yeah, the reason. So in each antenatal clinic, we do your blood pressure, and we plot it somewhere, and you can see this one. Today it was 120, tomorrow it is 150, and say, wewe tunaona you might start getting, yeah. So when you have a high blood pressure, then you repeat it, usually after 6 to 8 hours when someone is comfortable, just to confirm that yes, indeed, this is preeclampsia or hypertension that is occurring. And once you see that BP is high, then you start on medication. You see, that prevents the continuation of that. So there are various medicines that are used in preeclampsia to manage the hypertension. So there is methyl dopa, one of the, which can go up to 2 grams a day. There is another medicine called nifedipine, in hypertensive terms, is a calcium channel blockers. There are some medicines of hypertension that you do not want to use while you're pregnant. You see, because they could cause effects on the baby, like maybe the kidney doesn't form because of that. So people who have previously come with blood pressure and now are pregnant, you may need to review the medicines they are taking, you see. Some like what are called ACE inhibitors, they may cause a problem with the baby's kidney. So you change the medication to these ones that have been proven safe in pregnancy. You can change them back after they've delivered, you see. Then tertiary prevention is, you have said this particular person got preeclampsia in this pregnancy. So while in the next pregnancy, then you start them even before they get the eclampsia. Immediately they are pregnant, then you can start them on these medications that preventing calcium, junior aspirin, and all. So that is some form of prevention. And of course, lifestyle changes. You know, you're preventing the same things that cause hypertension. You don't want to become obese, you know, overweight. You want to do exercise. You want your nutrition to be good, because there's some nutrition that is associated with these lifestyle diseases, especially hypertension. So you need to see your nutritionist. Then you also want to do a regular checkup on yourself, you see, just to prevent issues that may lead to preeclampsia.
Daktari, thank you. I know there is a pregnant mom watching, na tumeongea tu, amesikia tu terms, HELLP syndrome, stroke, organ damage. Please, words of encouragement to that woman who has preeclampsia.
Oh no, the beauty is that there is help, and this is the reason you come for preconception counseling. You know, sometimes they say, unaenda kuona daktari na hauna chochote, you get. So these are some of the things, a lot of the issues. Of course, we come in now when we are, but we are engaging more and more in this preconception counseling, where we advise you to see your nutritionist, to do exercise, to avoid smoking, you see, that's preconception counseling, and telling you what to expect should you get pregnant and how to detect these symptoms early. So that's the beauty, is that there's preconception, there is now antenatal care. It is not just routine to go. In fact, when they go there, wanapima, walienda tu wakanifinya tumbo hapo akaenda. That's very important. You see, it might look routine, but only 15% of the pregnancy is complicated. The only problem is that you don't know which 15% is. Therefore, you have to do antenatal care for everyone. And in each antenatal visit, you must have your blood pressure taken. And once your blood pressure taken, when you are pregnant, then you need to be on follow-up by your health personnel. And the health personnel must detect these symptoms early and manage them. Now, so the management of preeclampsia includes that follow-up. And sometimes as it goes on, then you are making as a decision as to, if this pregnancy continues, will we get more damage to the mother and to the fetus? You see? So those are the decisions made by the healthcare workers there. So you might even find that some babies are delivered early. You get, because you've given medication, the BP is even going higher, or the end organ damage is increasing, meaning you are now getting those HELLP. Once you start getting those HELLP syndrome, acute kidney injury, then you have, the treatment is actually delivery, you see? Because when you remove this placenta, what was causing it? Yeah. So now how to deliver is now a discussion with the gynecologist. They assess and see, can this baby go through labor? You know, the baby is already in stress. So will the labor increase the lack of oxygen? And so some, if they assess and say, this can go through labor, they can do what is called induction of labor and deliver the baby. If they think this baby cannot withstand this stress, then a cesarean section is easier, safer for both, for the baby, you see?
Wow, that has been preeclampsia, pregnancy, preeclampsia with Dr. Simon Kigondu, our gyna. I think maybe after this, utakuwa unaniita kama a doctor, stroke nutritionist, because I have learned a lot. And also you can let me get in the comment section what you've captured, what you learned, and also you can suggest any topic that you'd love us handle. So that has been our topic. Subscribe until next time.